Okay, you have, did anything happen? Okay? Yes or no? The yes or no will direct your next set of questions. Okay? If they had a response, that's a red flag, right? Because that means that if we're going to administer this contrast agent, they may have the same allergic response. If they said no, should that still be a red flag?
Yes.
Okay, because remember, the first time, nothing may have happened because that's the first time they got introduced to that antigen. So the second go around, they may have an allergic reaction. Is that making sense, guys? So what I'm saying here is with iodinated contrast, you should never ever let your guard down. It doesn't matter. You should always be guard up. Okay? Always be prepared for something to happen. Because when you least expect it, it's going to happen. Okay? All these questions, asthma, heart conditions, okay, any type of debilitating diseases or conditions, all this can contribute to the possibility of having an anaphylactic reaction. Remember, if you're allergic to foods and medications, have asthma, hay fever, COPD, okay, it increases your chances of having a response or reaction 3 to 10 times more. Okay? So here are the universal precautions of drug administration. What is universal precautions by definition? That all patients, what? You're going to treat all patients as if
They're infected.
they have some kind of disease or infection because you're protecting yourself. Where here's the universal precaution of drug administration. Same thing applies here. We're going to treat every single patient that comes in as if they have the potential of having an adverse reaction. Okay? So all drugs are potentially harmful. Never become casual or careless. Like anything else, you can't perform a procedure without having a physician's orders. Especially if you're administering contrast, there better be an order that accompanies that. Okay? As we said before, the healthcare worker must understand the intended action, contraindications, possible side effects, and potential adverse effects. Again, all you thought was just, ooh, we're just pushing buttons, hold your breath, don't breathe, don't move. That is a small portion of what we do as technologists. There is a bigger part. We are clinicians. We are healthcare givers. Okay? We are patient advocates. There's a lot more that we do as technologists than pushing buttons. Okay, so the 5 rights of drug administration. Before administrating, you have to confirm and reaffirm these items. You have to confirm and reaffirm that you have the right patient. Okay? Sounds very elementary, right? Doing the x-ray on the right patient. Don't you hear about medical errors where the procedure had been done on the wrong patient? Oh, do you hear about it a little bit or you hear about it a lot?
Quite a lot.
You hear about it a lot. Okay? Here's an example. Okay? You are on the radiology department, you get a requisition to do a chest x-ray on a patient in bed 5 in the emergency room. Okay? So you get your requisition, you get your portable, you get your cassette. You're making your way down to the emergency room. You go straight to bed 5, okay? You sit the patient up, put the cassette behind them, take a deep breath in and hold it, click. Okay? Is there a problem with that sequence that I just did?
Yes.
Okay, what's the problem?
They move patients around a lot.
They move the patients around a lot. So when I got my requisition and on my way to the emergency room, they moved Miss Jones from bed 5 to bed 11. So yeah, that happens. So what should you have done?
Ask the patient for their name.
Okay, ask them for their name or check their ID. Okay, make sure that their name or their ID matches with your requisition. Here's another example. Outpatient, if I'm going to the waiting room and I'm asking for Miss Jones. Come on, guys, how common is the name Jones? How common is the name Smith? How common is the name Garcia, Hernandez, Wynn, Brown? You guys seeing where I'm going with this? Gonzalez. These are names that are very, very, very common. Okay? If you're in a Hispanic community and you ask for Gomez, I guarantee you at least 3 people are going to stand up. Okay? Now, how are you going to differentiate one from the other one?
First name, middle name.
Okay?
Birth
Don't
name.
go by the last name. Also go by first name. Okay? Birth date. You see where I'm going with that? Here's another example in a Vietnamese community, because I've worked a lot in the Vietnamese community. I ask for Nguyen, Pham. Those are all common last names. Instead of 3 people standing up, you will have 5, 6 of them standing up. And not only that, they'll have the same first names. Oh my God, what do I do now? Okay, all right, all you guys are having x-rays, let's go. Okay, but you have to, you have to use those information to make sure that you've got the right patient. Okay, listen to your patient. Okay, right drug, make sure that you are using the right contrast agent. When I also, well, we'll talk about that later. The right amount. Again, each procedure will require a minimum amount of contrast that you're going to use. Right route, okay, vein, artery, joint, back, spine, we need to determine the right route and the right time. When we administer contrast agents, we always have to document time. Always got to document time, okay? Any questions here? All right. So you are going to, before you draw it up, you're going to make sure that you've got the correct contrast. In your department, you're not just going to have one contrast. You're going to have different types of contrast. They all have iodine, but they all have different concentrations. Make sure that you are using the correct concentration for that particular study. So, how many times should you be checking the label? A minimum of what? 3 times. A minimum of 3 times. All right? The contrast should be clear. It should be transparent. Just like anything else, it also has an expiration date. If the contrast sits in storage for a long period of time, the substances can start to accumulate and cause sediment within the contrast. Do you want sediment being injected in your body?
Mm-mm.
We do not. So check for clarity. Check for expiration date. Discard of unmarked or poorly marked containers. Remember what we said? When in doubt, what are you going to do? Throw it out. Okay? If it is questionable, just get rid of it. And get one that you know is guaranteed that you have the correct contrast at hand. If it's open, get rid of it. If it looks like it's been used, get rid of it. Okay? All right. Last one here. It is a drug, so it must be locked properly. Yes?
Does it count for those drugs that we are going to use in the hospital?
Mhm.
So if we feel that we need to throw it away, so we need to inform them that this was.
No, it's not like a narcotic. Narcotics you have to account for.
Also like iodine
Yeah.
and stuff like that. You don't
Iodine you don't have to account for. If you're not sure what it is, just get rid of it. For different types of narcotics, the nurses are there constantly counting because they know what they started off during the day, and they write down each narcotic that you use at the end of the procedure. And at the end of the day, it's like banking. If your numbers are off, they have to do a whole audit of the entire day to find out where that narcotic went, because
It's dangerous.
It's a drug.
not only is it a drug, but medical workers have been known to
Steal 'em.
take them because they're highly addictive. Okay? So with contrast, no, you just get rid of it. It's not an addictive drug. It's not a narcotic. look at. Number 7 here, okay? Going back 3 or 4 weeks ago, remember surgical procedures, right? You had a sterile technologist or a scrub tech who scrubbed in. Then you have another person in there who's circulating, right? I'm not going to break scrub and remove my gloves to get my drugs or equipment or instruments for a procedure. I'm going to have somebody do that for me. So if you're the circulator, and you get one of those contrast agents, before you have them draw it up or before you pour it into their cup or receptacle, I'm going to verify it, okay? And then I'm going to show it to my technologist to verify. And when he or she verifies it, now I can pour it into the sterile cup, or I can hold it up for them so they can draw from the vial. But I'm verifying it, the technologist is verifying it, okay? Do not combine 2 drugs in 1 syringe without verifying the compatibility, okay? Check label 3 times before drawing it up or pouring. Take 1 drug to 1 patient at a time. What that means is in a radiology department, especially in special procedures or in procedures that's very complex, you will be dealing with other drugs. You're not only dealing with contrast, but you'll be dealing with lidocaine, heparin, nitroglycerin, verapamil. Did I say nitrogen?
Mm-hmm.
No, not nitrogen, nitroglycerin. Yeah. So those are just a few drugs that you will be handling as technologists. They're all clear. The labels is what differentiates them. Okay? But don't be taking all your drugs together at one area and then just giving them to your technologist. You want to do it one at a time. So I can verify it, my technologist can verify it. Okay? Identify the patient before administering. Explain drug procedure to the patient before administration. A drug history must be taken before administration. Same thing again. Ms. Jones, are you allergic to any drugs or medications? Here's another one, number 14. I mean, we've already talked about this. Number 14. Do not administer a drug you haven't prepared yourself. If you are setting up your sterile tray, okay, and you step away for a minute and then come back and all of a sudden you find liquid in one of your receptacles, what are you going to do?
Get rid of it.
Just get rid of it, because if you didn't prep it, you can't take anybody's word on it. Oh, that's just lidocaine, or that's just contrast. Okay? All the drugs that you're going to be working with are called drugs. They can cause physiological changes. So when in doubt, toss it out.
And don't you have to like verify before you even?
Exactly. But, you know, in case when you're in a hurry, you got multiple people helping you out with your trays and you're just pouring stuff and putting stuff on your table without you knowing what it is. Okay? That's just the way it is. Okay? Because we're trying to expedite things.
But radiologists trust you, whatever you give them.
Yeah, they do. The radiologists have a very high trust on you. Okay? So it's critical what you do can eventually affect the patient, so they do have a lot of trust in you. Okay? All right, any questions here? So when in doubt, toss it out unless you prepared it yourself. And that's another reason why, and I think we talked about this before, is I usually don't set my tray up, okay, until the patient enters the room. Okay? I don't like to set my tray way ahead of time because as a rule and guideline, you are never to leave your open tray unattended because of that. And also because it can be easily contaminated by somebody who's walking in and out of the room. So I don't open anything up, okay, for all aspects of safety until my patient comes into the room. Okay. Report and document drugs the patient refuses to take. Document any drug administered immediately. This is part of your charting. Do not leave the patient who may be experiencing an adverse reaction. That makes sense, right? If somebody's having an adverse reaction, what are you going to do? Stop what you're doing, call for help, be ready to assist, take vitals every 5 minutes. Remember that? Comfort your patient to lower the anxiety, sit them up, be ready to perform CPR just in case. Okay? A patient who has been given a sedative, a hypnotic, anti-anxiety, or narcotic analgesic drug must not be allowed to drive home. Generally, these patients will know ahead of time if they are going to be receiving some of these drugs. So they shouldn't be driving here by themselves. Okay? A child who has received a medication, any type of medication, including contrast, and is sleeping may not leave the department until fully awake. We want to make sure that they are arousable. Number 20, patients must be observed for 1 hour before leaving the department after receiving any drug, again, including iodine. So if they have an iodinated procedure, you're still going to keep them in your department for at least another hour, okay? Because can patients have a latent effect to contrast agents that you administer? Yeah. So, I mean, generally if you have an allergic reaction, it should manifest themselves within a few minutes. But they have been known to manifest these symptoms, itchiness, coughing, sneezing, 34 minutes later. Okay, so we're going to keep them in our department for a little bit. All right, any questions so far? All right, so we've got some abbreviations here that I want you guys to learn and memorize, because we also do charting, and you want to use the appropriate abbreviations. These are standard. This is what's used from one hospital to the next. Again, Latin is a funny language, and sometimes it's 3 or 4 words to describe one thing. Okay? So we have abbreviations, but they are standardized, and you must use the appropriate abbreviation for the right time. PO. You guys already learned this, right, in medical term?
Yeah.
PO by mouth, IM intramuscular, IV intravenous. STAT means at once or immediately. VO is verbal order. SQ or SC means subcutaneous. We also say sub-Q. Okay. ID for intradermal. BID twice a day. GTT drop. CC is cubic centimeter. And CC and ML, they're used interchangeably. They kind of have the same volume, so they're used interchangeably. AC before meals, PC after meals, HS at bedtime, PRN as necessary. Q is every, QD is every day, TID is 3 times a day, and Q2HRS is every 2 hours, and then ML is milliliter. We're done. We'll continue.